Hello, everybody. Welcome to our SRC University live presentation. Today's topic is Medicare Changes in 2025. And we wanted to start this series that we're going to do of live webinars with Medicare because this is one of the critical things that are easily confused when you're trying to decide if you're going to retire. Are you going to retire next month or at the end of the year or in the future? And also don't forget about our More Money for Retirement. That's a great resource as well as our SRC University webinars to discuss and decide, what you want to do for your retirement. So we thought Medicare gets really confusing, so we would start with this one in September. So part of our SRC University series is we like to do retirement education because there's just a lot of information out there, and our job and what we'd like to do for the community is to make it simple. And so we keep them into 30-minute sessions. You can watch these live webinars on the days that they're offered, but also they'll be listed on our website under our SRC University webinar series, and you can go and use those at your own schedule. And then a lot of this comes from the topic in our book. So if you are interested in getting a softback copy of our book, just go to srctexas.com and you can get it for free. We just ask that you pay for the $5 in shipping. But our ultimate goal is to create a safe, secure retirement. And the good news about our school is there is no final exam. All right, so at Senior Resource Center, we help out in 4 distinct ways. We do comprehensive retirement planning, looking out into 20 and 30 years in the future to see and make sure you're not going to outlive your money. We do tax planning, not tax prep. We do a lot of long-term planning, and that includes helping people with federal and state programs like Medicaid for long-term care and VA for long-term care, and then estate planning, helping people to avoid probate and making sure they have their legal house in order. All right, so this Medicare series is actually going to be a 3-part series, but it's going to be split up over 2 months. Today, we'll be discussing Medicare changes that are going to happen in 2025. And then in October, when the Center for Medicare comes out with the new premiums and deductibles for Parts A and B, we'll be launching the second part of our series, which will be comparing the options, the coverage, the cost, and the change. Those 3 C's are how do you make your decisions between traditional Medicare, Medicare Advantage plans, and Medicare Supplement plans. And then our third part of the series will be showing you in real time how to enroll in Medicare coverages, whether it's signing up for A and B, getting on the Medicare.gov website to sign up for an Advantage plan, or to look at what your best drug plan is for the year. All right, and with that, I'm going to hand it over to Bill.
Hi, everybody. Thanks for joining us today. As Tara said, today we're going to focus on Medicare. And why is it important? It's because most people rely on Medicare for their health care and retirement. And as any government program, whether it's Social Security, Medicare, Medicaid, VA, all of them are more confusing than they need to be. And so our job is to educate people on the different options. Understanding your options is kind of critical, because if you make the right choices, it can be the basis for a safe and secure retirement plan. So today's topics, we're going to spend most of our time talking about the changes, but I want to start out just by making sure everybody's on the same playing field, so we understand what Medicare is, what the basic options are in 2024. And then we're going to spend most of our time talking about the rapid and significant changes that are occurring in Medicare starting in 2023 and going out through 2026. And finally, we'll hopefully save some time for your questions. So what is Medicare? Medicare for most people is health care or health insurance if you're 65 years of age or older. But Medicare can also cover people under 65 with certain disabilities, and it can also cover people with end-stage renal disease, kidney problems. Medicare is offered through the Centers for Medicare and Medicaid, CMS. They're the ones that control it. And what the government offers is augmented by private insurance companies. We'll talk about different pieces of the Medicare puzzle that they provide. And finally, Tara mentioned we're going to do a webinar strictly on signing up for Medicare and various Medicare coverages. But the original site you go to is www.ssa.gov, so the Social Security website, to sign up for Medicare A and B. So, as I mentioned, these government programs can be complex. Each year, most people on Medicare or of Medicare age get a copy of a book called Medicare and You that's about 200 pages of fine print. And we decided to simplify that whole 200-page book by bringing it down to a single 8.5 by 11 sheet of paper. So on this page, you can see the building blocks for original Medicare and for Medicare Advantage on the right side. And we're going to walk through each one of these. In 2024, this chart is devoted to 2024 because, as Tara mentioned, we don't know the deductibles or some of the premium payments for 2025 yet. But the basic building blocks of Medicare start with Part A and Part B. You can only get these from the government. Part A is your hospital coverage and nursing home rehabilitation. Now, there's no premium for Part A for most people, but Part A has a per event deductible. So if all I have is Part A and I go to the hospital, I would pay $1,632. If 3 months later I have another trip back to the hospital, I'd pay another $1,632. So it's a per event deductible. And then there are additional copays based on number of days in the hospital. Part B is your doctor and lab. And for most people, they pay a monthly premium of $174.70. Higher income people do pay an IRMA surcharge or a higher amount. With Part B, the annual deductible is $240 this year. So that's a one-time deductible. After you met that, you're covered pretty much 80-20. 80% by the government, you'd pay 20%. And there is the potential for excess charge. Some doctors add on an additional 15%. But as we'll talk about as we move to supplements, that can be covered. So the next block on top of that is what are called Medigap policies or Medicare supplements. And they're designed to fill in the gaps that A and B don't cover. You can only get a Medicare supplement or Medigap from a private insurance company. And this year there are 10 standard plans, plans A through N. And we talk to most of our clients about plans F and plan G. And with a supplement, you have a monthly premium. But as you're going to find, once you've gotten the supplement, you're pretty much bulletproof doctor, lab, and hospital. So here's kind of a summary of the supplements that are available in 2024. Plan F is a great plan. That's one I'm on. I have no copays, no deductibles, doctor, lab, or hospital. But you had to be 65 by January 1 of 2020 to get a Plan F. If you aged into Medicare after that, well, then you can get a Plan G. And it's like the kissing cousin of Plan F. It's almost identical, with the exception the one thing it doesn't cover is that annual deductible for Medicare Part B. So if you're on a Plan G, you'd pay $240, the annual deductible. And after that, wherever you go, doctor, lab, or hospital, you're bulletproof. There's no out of pocket. And that can include going to MD Anderson for cancer treatment or going into the hospital for quadruple bypass. These are all expensive events. But if you're covered under F or G, you're bulletproof. Now, for people that are on a more limited budget, there's another option called Plan N that we review with people. And there you'll notice there are some copays. You have a $20 copay if you go to the doctor or specialist. You have a $50 copay if you go to the emergency room, but it's still a pretty solid coverage, and it has a lower premium than F or G. So the fourth box on the left side of the page is prescription drug coverage. And as we're going to cover as we go through this program, some major changes are occurring in Part D. Part D plans are only available from private insurance companies. So like a supplement, you have to go to an insurance company to get it. The difference is when you're on a supplement or a Medigap policy, those are lifetime plans. You don't change annually unless you want to. But with prescription drug plans, they are annual plans. They start January 1st and they end on December 31. And so we strongly recommend to all of our clients, you want to go back to medicare.gov, medicare.gov each year to identify your best option for the coming year. And, as I said, you can compare plans for the coming year between the period of October 15th and December 7th. If you're on a plan and you don't make a change, you just roll into the next year on the same plan. So you can go to medicare.gov. You can compare plans with creating an account or not without creating an account. Either way, you're going to build a drug list, name, dosage, and frequency. You'll select a pharmacy. Then the beauty of this website is it ranks all of the plans. In this case, in 2024, there's 21 plans. It ranks them by their lowest annual cost. That annual cost includes deductibles, co-pays, anything that you're going to be out of pocket. So it pretty much tells you, out of the 21 plans that are competing for your business, here's your best deal based on the drugs you take and the pharmacy you selected. Now, if you decide to switch plans during this open enrollment period, October 15th to December 7th, by signing up for a new plan, you automatically disenroll yourself from your current plan. In 2024, there were 3 phases of coverage for drug coverage: a deductible phase, an initial coverage phase, and then what was called the coverage gap or the donut hole. I'm not going to go into great detail here because in a later webinar, we're actually going to compare original Medicare options to Medicare Advantage. But one significant change that took place that we'll cover in a little more detail is they've now, in this year, for the first time, they've literally capped the out-of-pocket maximum that you could run into for prescription drugs. Before this year, there was never an out-of-pocket maximum. So we quickly covered what's on the left side. You get Part A, Part B, you get a supplement, you get a drug plan. That's original Medicare. What do we have on the right side of the page? Well, they're called Advantage plans, and they come in many flavors. Advantage plans can only be acquired or purchased from a private insurance company. You can't get an Advantage plan from the government. But to get an Advantage plan, you do have to be signed up for Part A and Part B. And you pay your monthly premium for Part B, and then you can pick an Advantage plan. Well, I said they come in different flavors, such as PPO. So what is a PPO? That's where there's a network of doctors, but I have the option of going in or out of network. Obviously, if I go out of network, I'm going to pay more for my coverage, but I do have the choice of being in or out of network. HMOs are closed network plans. They usually have no premium, which makes them attractive financially, but I'm limited to the doctors that are inside the network. I have to stay in network if I want coverage. Then there's also private fee-for-service plans and special needs plans. The special needs plans are designed for people that have a specific medical condition, or they could be for people that are on, say, both Medicare and Medicaid. Medicaid is a separate government program. If you're a dual eligible, there are special needs plans for those folks. How do you select an Advantage plan? Once again, go to medicare.gov and it will help you identify the plan with the lowest annual cost. Advantage plans are kind of nice in that you can change annually without medical underwriting, but there are co-pays for most services, and most plans have an out-of-pocket maximum that can be substantial. So you want to investigate. And as I said before, we're going to do a webinar solely on talking about the coverage differences, the cost differences, and change differences between the left and the right side of the page. So let's talk about what's changed. And really the last 2 years and what's coming in the next 2 years are major, major changes to Medicare and how it helps people. Back in 2023, there was a major change in that they finally capped the cost of insulin for many drugs at $35. There's a lot of people in this country that have diabetes, and this was a major change helping cut the cost of insulin for those folks. The other change they made with Medicare, there's always an open enrollment period that starts on January 1st and runs through March 31st. So who uses this? People that forgot to sign up for Medicare when they turned 65 and weren't covered under group health. Well, they can sign up once a year during this open enrollment period. You used to have to wait till April 1 to get your benefit. But now, if you sign up during the month of January, your benefit starts the first of the next month. In 2023, we saw the addition of new vaccines for shingles, for COVID. These are covered by Medicare. That's kind of a good feeling. They also redesigned the Social Security website, making it easier to use, and they introduced extended warranties on hearing aids. So what happened this year? Well, 2024 was a watershed year for Medicare. Up until 2024, there was no cap on what you paid for prescription drugs. And there were four phases called different phases. And the fourth one was the catastrophic phase. If you got into that phase, you could pay 5% of the cost of drug payments, even if your out of pocket had exceeded $8,000. Since some drugs cost tens of thousands of dollars per month, that 5% was still substantial. But in 2024, finally, for the first time, we've capped the maximum out of pocket for people taking prescription drugs. Another major change, they expanded eligibility for financial assistance. Now more low-income people have the ability to get their Part D coverage at a much lower price. And another major change, many families are affected by dementia, by Alzheimer's. Well, what did we see in 2024? For the first time, Medicare is moving into this realm and helping with what are called guide services, guiding an improved dementia experience. And this program makes available counselors for families. They provide respite support for caregivers. There is up to $2,500 in financial assistance for families with people that suffer from dementia or Alzheimer's. So let's fast forward to next year. What's coming next year? And boy, the changes are big. Next year, we see more reduced spending for expensive drugs. The coverage gap, the third phase, has been eliminated. So now there's only the initial, the deductible phase and the initial coverage phase. But the big difference is your out of pocket is going to be capped at $2,000 for the entire year. That's a big change. For someone who's on a cancer drug that's $8,000 or $9,000 a month, after they've spent $2,000, they're bulletproof the rest of the year. And we feel really good about helping people navigate the Medicare.gov website to find their most cost-effective plan. Well, since the drug plan coverage companies, the insurance companies, are going to be paying more for drug coverage, it's really important now that every October 15th to December 7th that you go back and check to make sure that the drugs you're on are still covered next year, because each plan has a formulary or a list of supported drugs, and those formularies can change year by year. So what's the problem with that? Just because I like my plan this year and it covers all of my drugs doesn't mean that next year they will still be covered. So if you're on an expensive drug, it's vital to go to Medicare.gov and rerun your drug list for the coming year to make sure you're still getting the best deal. Now, because the drug coverage companies, the insurance companies, are paying a higher amount of drug coverage, we expect drug and Advantage plan premiums may increase in 2025. All the more reason to check at Medicare.gov to make sure you're getting the best deal. The other thing we anticipate, since Advantage plans, some of them are offered at no premium, no fee, we believe that because they're going to be absorbing more drug plan costs, there could be cut in benefits. So it's vital that you check to make sure that if you're on an Advantage plan, you're still getting the benefits you got this year. What are some of the other significant changes in 2025? Well, Medicare is not allowed to cover drugs strictly for weight loss. So drugs that are very popular right now, like Wegovy, Ozempic, and Mounjaro, have not been available to Medicare recipients. But what's changing in 2025, if the drug you take it supports not only weight loss, but also addresses another medical condition you have, like let's say you have cardiovascular disease. Well, now a doctor can prescribe Wegovy, even if the primary use is for weight loss. What if you're a diabetic on type 2 diabetes? Well, Ozempic and Mounjaro are now going to be available and covered under Medicare. Since weight loss is a critical issue in our society, this is an important improvement. The two other big changes are support for another major condition. Many people suffer from mental health, or they want access to a marriage or a family counselor. Well, up until 2025, these experts, these licensed professionals, were not available under Medicare, but they will be starting in 2025. What about as expanded dementia caregiver support? I mentioned the GUIDE program. Well, in 2024, there were only 96 providers in the country that could offer this type of care and support. They're expanding that. They're adding another 294 providers. So now almost across the country, you'll have access to a much larger pool of people that specialize in dementia and Alzheimer's care. It's an important improvement for Medicare. And finally, Advantage plans, some of them come with added benefits for like dental or vision discounts. And what they found is that many people, after they signed up for the Advantage plan, weren't taking advantage of all of the benefits. So now the companies are required to send out a mid-year statement and say, gee, you have an Advantage plan that offers dental discounts or vision discounts, but you haven't taken advantage of it. It's just a friendly reminder that there's benefits that you want to not overlook. Finally, what's going to happen 2 years out in 2026? Well, for the first time in the history of Medicare, the government is allowing Medicare to negotiate directly with pharmaceutical firms. And they've identified 10 expensive drugs that will be part of this pilot program. If you and I lived in one of the European countries like France, Germany, or England, or we lived in Canada, we wouldn't pay the high prices for these drugs that we're required to pay in the United States. Why is that? Because those countries have nationalized health care, and the government negotiates with the Pfizers and the Squibbs and the different drug manufacturers to get lower prices for their country residents. Well, starting in 2026, these 10 drugs are now going to be negotiable, which means you'll see much, much lower prices. Our hope is that the government sees fit that not is to expand this list, not just to these 10 drugs, but to many more expensive drugs that are now being offered at a reduced rate in other countries. We've covered an awful lot in a very short period of time. Tara mentioned our book, More Money for Retirement. Check out our website, srctexas.com. You can download a free electronic version. If you want a printed copy, we're more than happy to send it out for $5. That covers our printing and our shipping and handling costs. As Tara mentioned also, starting next week, we're going to discuss 3 different webinars talking about how to maximize your Social Security benefits, another vitally important component in a safe, secure retirement. So if you have family members that are nearing retirement or might have need for a knowledge on how to maximize their Social Security benefits, send them in an email to us, and we'll add them to our list and invite them to join us for those webinars. So,
and as always, don't forget, you have an opportunity to come in and sit with us. You can go on our website and get an appointment, or you can always call us for an appointment, and we're happy to go over your Medicare questions and things that are specific to you, or even sign you up for a plan if that's what you need. So we look forward to seeing you next time, and have a wonderful day.